Why do nurses and hospital staff walk around in public wearing their scrubs? Also, they might not be human or regular medical staff. Veterinarians, vet techs, dentists, dental assistants, dental hygienists all wear scrubs. Some people who work housekeeping type jobs also wear scrubs. Some people just genuinely like scrubs and how comfortable they are. No way to know what job they do and why. I don't know about you, but if I have errands to run on my way home from work, I'm wearing whatever clothes I wore to work. Also, if you've never taken a scrub top off, some of them are only slightly easier to get off than a straight jacket. Mostly, it's because hospitals don't provide changing rooms locker rooms for 90 of their staff. The staff that's in surgery or anywhere that would have a contamination problem they tend to provide a locker room for. Most of your hospital staff are required to wear scrubs even if they only ever work a desk. I don't know which would be worse germ virus-wise, my friend wearing their scrubs home from the clinic or the bus seat that they are sitting on. Have you never left work and gone somewhere else with your work clothes on? I wear scrubs and am just admin. Some days I don't even see patients. They are probably walking to their jobs. Depending on the office, it's not like they have any issues as far as exposure to blood or other matter. My mom is a housekeeper and wears scrubs for work. Curious where you are from. They probably work 12-16-hour days if you include commute time, and they are probably trying to do things before after work. I do errands in my work uniform all the time. Hairdressers, the ladies and men that do nails, waxing, lip injections, many people. I was a medical assistant lab tech phlebotomist at a small rural clinic attached to the county hospital. I wore my scrubs in public because I was not going to carry around a change of clothing and change at work. Also, not everyone in scrubs is working at a hospital. As for germs, most people who are in that kind of exposure are going to be gowned. You could have seen 100 estheticians who wear scrubs to wax assholes all day. Elmo. Scrubs are not a certification, and the colors for actual hospital staff are because hospital administrators chose a color scheme for their building. It's not a universal system. Yes, and they are nurses and doctors. Why assume nurses just? No. If something is so contagious as to get on your clothes and then somehow jump someplace, they are wearing full isolation type gear in those situations, and even just PPE covering over their clothes. No. Remember, you're in a big city, so people in scrubs are not just from a hospital, they are also from vet offices, spas, a lot of times, other office medical settings. I imagine it's due to inhumanely long shifts and very little free time. I sell scrubs, lots of them, from basic utilitarian function to high-end style and fabrics. I can list at least 30 occupations that use scrubs. Currently, many are made in styles close to ready-to-wear and don't look like traditional scrubs. A good number of fabrics utilize antibacterial properties. In the last week, I've put the following in scrubs along with general patient care, such as hands-on medical staff FFA group from a local high school, cafeteria workers, restaurant staff, servers, teachers, elder care activity staff, child care, radiology students, a fantastic group of ladies in their 80s and above that attend group exercise classes. They also walk a lot of 3K and 5K and love to color coordinate. Spa personnel, bartenders, clerical staff, and many different places, painters. I've probably forgotten some, but there are many. Sometimes I have stuff to do before or after work. I'm not going to bring different clothes for that. Keep in mind, not all of us who wear scrubs have patient contact. I work in a medical call center, but have to wear the same color-coded scrubs as the other receptionists who work the front desks in the offices. I work in a closet a few miles from the hospital. My mom has to wear scrubs at her job despite the fact she is only doing data entry at a location that doesn't even see patients. So her grocery shopping while wearing them isn't more dangerous than an office worker doing so. Also, I feel like I should say something about scrubs hanging out of the passenger window of his best friend's car.